The World Health Organization, WHO, is a specialized agency of the United Nations established in 1948. The WHO allows all sovereign states, even those not belonging to the UN, and territories to memberships of varying levels. There are presently 194 member nations, including China and the United States. The focus of the WHO is to issue global health alerts and take preventative measures against the spread of international health threats. They have worked with eradicating smallpox and have made strides in matters related to polio, leprosy, cholera, malaria, tuberculosis, and HIV and AIDS. The agency also sponsors research for other diseases. The WHO has conventions for preventing the spread of international diseases such as sanitary and quarantine requirements. Essentially, the WHO acts as a directing and coordinating authority on international health work within the UN system. They are working to promote health, keep the world safe, and serve the vulnerable. According to WHO's website, their funding comes from trust funds available through the APOC, contribution from the national governments of APOC countries, and funds from non-governmental development organizations. Presently, the United States funds about 15% of the WHO's organizational budget, making us the largest contributor. The WHO spends over 80% of its fundings on technical and operational activities in endemic countries. Especially considering today's pandemic, the WHO's role continues to remain essential due to its core global functions of establishing, monitoring, and enforcing international norms and standards, and coordinating multiple actors toward common goals. The United States needs to continue to fund and work with the WHO to help provide resources and information necessary to contain and eliminate the spread of the coronavirus. The United States does not need to act like China in 2003 with SARS and withhold cooperation with the WHO. China learned their lesson after SARS and was transparent with the WHO during the 2019 COVID outbreak. The USA needs to continue to follow suit for the betterment of the world. This pandemic is not an us versus them situation, but a global crisis which requires the cooperation of all nations to eliminate the spread of the virus. According to Tom Inglesbury, director of Johns Hopkins University's Center for Health Security, the U.S. needs the World Health Organization to function properly. It is the organization that helps the world prepare and respond to this. We are going to need the world to recover from COVID if we're going to get normalcy back. In the words of Senator Patrick Leahy, withholding funds for WHO in the midst of the worst pandemic in a century makes as much sense as cutting off ammunition to an ally as the enemy closes in. Withholding funding would decrease the WHO's ability to assist the vulnerable in other countries like Somalian refugees and other war-torn countries, and would only continue the dangerous spread of the virus. Cooperation is key for eradicating COVID, and we cannot risk isolating ourselves from the world now, otherwise blood will be on our hands.